my YouTube channel. Today's topic is going to be STDs. STDs are sexually transmitted diseases. My name is Sarah Dong. I'm working with the Comfort Home Nursing Care Services, where we do post-surgery and wound care, stroke recovery, palliative care, early discharge from hospital, physiotherapy, dementia care, diabetic care, cancer care. With today's topic being STDs. What are STDs? These are sexually transmitted diseases. How do you get the sexually transmitted diseases? By getting into a sexual contact with an infected person. The sex can be through the vagina, through the anus, or through the mouth. I am so sorry about the watermark on the screen, but my technical team is working hard to make sure that it is removed. STD number 1, gonorrhea. Gonorrhea is a bacterial infection. It is caused by bacteria. You get it through having unprotected sex with an infected person. Gonorrhea in men, it is a little bit, the signs come earlier than in female. How do you know when you're a man? How do you know that you have gonorrhea? Number 1, burning sensation while passing urine. There is that pain when you go to urinate. You feel a lot of pain. Number 2, pus discharge from the penis. Dripping pus from the penis is sign number 2. Painful defecation. When you go to pass stool and you feel a lot of pain, that's a sign of gonorrhea. Rashes around the anal area. Also, burning sensation around the anal area. Swollen scrotum. The balls or the scrotum is always swollen when you have gonorrhea. Reddening of the tip of the penis is another sign. Signs and symptoms of gonorrhea in female. Most times, those signs and symptoms in women tend to be mild, or it can go away unnoticed, but that doesn't mean you are unable to transmit the disease to your partner. Sign number 1, vaginal discharge. The discharge is always greenish in color, yellowish or whitish, but it is always a lot. Painful urination. When you go to urinate, there is a lot of pain in your vagina. Frequent urination. You feel you want to urinate all the time. Heavier periods between your periods. When you get your periods, usually the periods are spottings. You get spottings in between periods. That's a sign of gonorrhea. Pain during sexual intercourse, mostly when it is a penetrative sex. When you're having a penetrative sex, you tend to get a lot of pain. Signs and symptoms when you have oral gonorrhea. Persistent sore throat. The sore throat tends to be persistent. Even on treatment, it might fail to respond, or you'll get it recurrently. Swelling of the lymph nodes. The lymph nodes are always swollen because the body is trying to fight the bacteria. Also, gonorrhea of the eyes. This is a type of gonorrhea that usually affects the children that get it through childbirth from their mothers who are infected with gonorrhea. So the babies tend to present with swollen eyelids. The eyelids are very swollen, reddiness of the eyes, and yellowish discharge from their eyes. We are going to STDs, or sexually transmitted disease number 3, which is syphilis. Syphilis is also a bacterial infection. You always get it through sexual intercourse, unprotected sex with an infected person. It can be a vaginal sex, oral sex, or anal sex, but when the person is infected. Also, syphilis can be got through during childbirth from an infected mother to a baby. How do you know that you have syphilis? Sign number 1, sores or painless sores that tend to be in the private parts. Painless sores, when you get painless sores on your penis or vagina or on the anus, which are painless, it's a sign of syphilis. The sores are always, they tend to be reddish in color. on the back, on the palm of the hand, or the sole of your feet. Swollen joints. The joints tend to be swollen. It can be anywhere as long as it is a joint. Swollen lymph nodes is also another sign that you have syphilis. Hair loss, fever, fatigue, all those are signs and symptoms that you could be having syphilis. Syphilis is a very serious bacterial infection. When it goes untreated, it can affect the major systems of the body, like the heart, the brain, and therefore it leads to blindness, brain damage, or heart disease. We are going to STD number 3. STD number 3 here is HPV. What is HPV? HPV is human papillomavirus. It is a viral infection, but also it can be got through unprotected sex with an infected person. How do you know that you have HPV or human papillomavirus? Presence of what's in your private part, in your vagina, in your anus, or in the mouth. What's growth? They are tiny growth that sometimes they are flat or sharp pointed that appear. It can be 1 or 2 or many on your private parts. That's a sign of HPV. Abnormal pap smear. Pap smear is a test that they use to screen cervical cancer. So when it comes out abnormal, it means you could be having HPV virus. Another sign that you could be having HPV is presence of cancer of the cervix, cancer of the throat, cervical cancer, anal cancer, or vaginal cancer. STD number 4 is HIV/AIDS. How do you know you have HIV/AIDS? It is very important and advisable to always go and test, because there is no very sure way that you could be having, or there's no way you can guess that you have HIV/AIDS. But the following are the signs and symptoms. Flu-like symptoms. You always have flu-like signs. You like between 2 to 4 weeks from the time you contacted the virus. Severe loss of weight. You tend to lose a lot of weight. Recurrent infections. You tend to get recurrent infections. Every time when you get recurrent infection, it's a sign that you could be having HIV/AIDS. Cough, very dry cough that doesn't go on treatment. Severe weight loss, fatigue, fever, loss of appetite, night sweats, persistent diarrhea, vomiting, mouth sores could be the signs and symptoms that you could be that can tell you that you have HIV/AIDS. STD number 5, trichomoniasis. This is a parasite or a parasitic infection, but you can also get it through sexual intercourse. As I said earlier, the sexual intercourse can be vaginal, anal, or oral sex. How do you know that you could have that you have trichomoniasis? Itching. Severe itching on your vagina or on your on your penis. Vaginal odor. There is a lot of a bad smell coming from your vagina. You have to check or go to hospital and check for trichomoniasis. Painful urination. It's also another sign. Discharge from the vagina or from the penis is also another sign. In men, you tend to get itching inside the penis because it is a parasite, could crawl and go there. Itching inside the penis. Burning sensation before ejaculation or after ejaculation. Discharge from the penis. Thank you so much for watching. With all we've discussed today, I urge you to always, when you get the signs and symptoms above, please visit your healthcare provider. Or you can visit us at Comfort Home Nursing Care Services. We shall be able to attend to you and give you the services you need. Thank you so much for watching. Please don't forget to subscribe to our YouTube channel so that you can get all our videos. Please subscribe, like our videos, and share. Thank you so much for watching.